Hey guys, Ashley with Amare. So, few resources for you guys. We are located in Elizabeth and Highland Park, New Jersey, and I also offer virtual consults. So, if you guys need my help, give the office a call, 732-841-0142, and our scheduling coordinator can help you get set up with an appointment. We also have our online shop. So, all the products that I talk about in my videos, those are all in our online shop for you guys to purchase. On our Instagram, Amare Healing Arts is our Instagram. All the products are linked right there in our bio. Also, the online shop is linked, and it's linked in the description box for each video. So you guys can go and check those out. And then we have our online course school, the Post-Op Academy. So all of the things that you would need to know post-op, we are doing online courses for. So things like what kind of massages you need, when you need to get them, who to get them from, how to find a therapist like me, all of that we have online courses for. There are going to be more courses coming out all the time. So check in on that to see what's new and what you guys can learn. If you like my videos, all of those courses are exclusive content. All those videos are exclusive content. None of them are on YouTube. They're all in our courses. So that is amarehealingarts.teachable.com. The link for that is also in the description box, and it is also linked in our bio on Instagram. So I hope you guys enjoy the content. Ashley with Amare. I will see you soon. Bye.
Hey guys, Ashley with Amare. Hi. Today we're going to be talking about facelifts. So this is just going to be a general overview. I'm going to do separate videos on each one going more into detail. But if you are thinking about a facelift, or you guys love to do this thing where you assume what you need without knowing exactly what the procedure is. If you're looking at your face and you're like, oh, this is sagging, I need something, this is the video for you. So today's article is brought to you by American Board of Cosmetic Surgery.org. It is the facelift guide. So if you go into Google and type in facelift guide, American Board of Cosmetic Surgery, you'll find this article. So types of facelifts. Facelift surgery is individualized to a patient's needs, and a cosmetic surgeon will tailor their techniques accordingly. So let's start with that. Guys, what is a facelift? A facelift is meant to lift and tighten skin or muscles and skin on your face. A facelift does not always include forehead or eyes. It's the 2/3 of your face. So it's cheeks, it's jowls, it's lips, it's lower face and neck sometimes. Now, when you guys say you had a facelift, that's a very broad umbrella. It's kind of like saying you had lipo. There are like 7 different types of lipo machines or ways of doing lipo. There are tons of different ways of doing a facelift. Actually, more accurately, when you say mommy makeover, that doesn't always include a BBL. That doesn't always include full lipo. Mommy makeover is usually, and I say usually because it's one of those terms that are very broad, it's breasts, abdomen, either stomach lipo or skin tightening, and then hips or BBL. Sometimes it's not hips or BBL. Sometimes it's just a tummy tuck and a breast lift. Sometimes it's just lipo to the back, a little skin removal, and a breast lift. Doesn't have to be a breast lift. It could be fat transfer to the breasts or implants to the breasts as well as a lift. There's lots of different combinations that make a mommy makeover. It's not one standard thing. So it's the same thing with facelifts. Facelifts is not a standard thing. There are lots of different kinds of facelifts, and they're all customized to the face that we're lifting. So it's different techniques, different areas of the face, different things that are done to give you a facelift. So it's not one standard thing, which is why I'm doing this video, and I'm going to do a bunch of others as well. So the 3 types we're going to talk about today are mini, standard, and deep. So we'll start with mini. Mini facelift. Patients who exhibit a mild degree of jowling, right down here, or sagging skin that are often are good candidates for mini facelift. This is a less invasive technique that allows a cosmetic surgeon to tighten the deep facial tissue. So that's not muscles, that's just tissue. The deep facial tissue through shorter incisions, typically located along the hairline, above each ear, and or natural creases around the ear. So it's all this area, right? And we're just doing this, and we're pulling all of the skin, just the skin. Okay. Through these incisions, structural tissue around the cheeks are lifted and tightened to correct jowling, refine the jawline, and rejuvenate a tired appearance. So we're doing this, right? Depending on the case, a mini facelift may be performed using local anesthesia with sedation or general. So I have a video on this. Local means it's like that twilighty situation. It's just this, you're not being knocked out. It's local or general, like with sedation, like they said, or general where you're out. Your cosmetic surgeon will recommend the best option for your individual needs. A mini facelift can help you address unwelcome signs of aging before they become pronounced, postponing the need for more expensive surgery for many years. So, mini facelift is just like a little bit. We just want a little bit of pull. That's it. We're not talking about like excessive face drooping or hollowness or any of that. We're just talking about a little pullback. That's it. It's a tiny little bit, and it's just the tissue. So it's not addressing this part. It's not addressing platysmal bands. It's not addressing any of that. It's just this for the skin. That's it. Standard facelift. A standard or traditional facelift, also known as superficial musculoneurotic. Wait, let me make sure I'm saying that right. I read it too fast. Musculoaponeurotic. There we go. System. So SMAS for short technique will more fully address moderate to advanced aging around the mid face and neck. So now the range is here. It's not just here across, right? Now the range is mid face to neck. So now we're addressing all of this with a standard facelift and SMAS facelift. While the surgery is more extensive than those for a mini facelift and thus more recovery time is required, we are going to get to recovery for each one of these at the end of the video. Recovery time is required. The results are more dramatic through incisions located just behind the hairline. So now the incisions are up here. They're not here. Now the incisions are up here. So near the temple and around the front of the ear, hidden in the natural folds, a cosmetic surgeon can reposition the deeper tissue beneath the skin and remove excess skin to smooth creases, eliminate jowling and sagging skin under the chin, and restore a naturally youthful contour to the face and neck. So we are not just pulling a little bit of skin. We can actually, if we need to remove skin, if we have too much skin, with a standard facelift, they can actually pull all of this, remove the excess, and tighten it. So it's everything under here, 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 all of it. So it's a wider area and it's more dramatic results if you have more laxity of skin. If you have too much skin, that's what that's for. So deep plane facelift. So I'm also going to do a video specifically on standard versus deep because they are, I don't want to say similar, but they get confused because a deep plane facelift requires a lot more work and a lot more healing time. And that's where a lot of people say they need a facelift, but they may actually need a deep plane facelift, because I have a lot of my clients that will get a regular facelift just to address the skin and the tissue and then be so unhappy. Like, I mean, livid, because, oh my God, I can see all these muscles in my neck now 24/7 and they look crazy. These are supposed to be here. See these? Let me do this. We're supposed to see all these contours, right? Even when I'm just talking naturally, if I turn, they pop out. Those muscles are supposed to be there. But those muscles over time can tend to stick out more or become laxed. And then when you're talking about tightening skin, if I do this to my neck, obviously, because I don't have a lot of like empty skin, you still see like tissue. But if you have empty skin and then you do this, you're going to have these lines all the time. So a lot of times what you might want to do is addressing the platysmal bands or doing a deep plane facelift if you're worried about that. Now, this is where it comes in with talking to your surgeon. Having a surgeon that knows how to do standard versus deep, having a surgeon that really specializes in facelifts is really, really helpful for this. You don't just want to go to somebody who's a surgeon that offers a facelift. You want someone who really knows what they're doing as far as facelifts. So during a deep plane facelift, a surgeon will reposition the deeper tissue and structures of the face, including the muscles. So difference is the muscles. Now we're addressing muscles, not just skin. So we're addressing a wider area and the muscles themselves. So this allows the surgeon to achieve more thorough lifting without tightly pulling the skin. So it's a less like appearance, because we're not having to tighten the skin as much because we're tightening all the structures. thus achieving maximum results while retaining a natural looking appearance. Deep plane facelift surgeons may also reposition fat pads in the cheeks, creating the appearance of a more lifted mid-face area. Deep plane facelifts are believed to provide longer lasting results than traditional SMAS methods. So what happens during a facelift? Now that we know all that, right? A little bit more about deep plane facelifts. For you guys, when they talk about repositioning the fat, remember when I said when we pull the skin back, you can actually see everything underneath? If those muscles are laxed underneath, you're going to see them, but also hollowness. We lose the fat and the collagen in our face as we age. So hollowing out of areas like under the eyes or in here, in the cheekbones, hollowing out of those areas, when the skin starts to sag like this, it makes them look really hollow. So what they're able to do is reposition the fat to fill them out, as well as pull the tissue so that it gives it that full youthful contour and appearance. Whereas a regular facelift, we're just dealing with the skin. We can actually reposition structures underneath with a deep plane facelift. So, what happens during a facelift? The exact technique a cosmetic surgeon uses during a rhytidectomy facelift depends on a number of factors, including a patient's anatomy and personal goals, the extent of the facelift, mini versus standard, and whether or not another procedure is being performed at the same time. So fat transfer to the face, something like that, or blepharoplasty, eyelid lift, which we're going to get to in a second, because again, I only mentioned 2/3 of the face to the neck. We didn't talk about any of this, right? Eyebrow lift or eyelid lift or forehead lift. None of that's included in a facelift, right? We're dealing with the face. So here, or all of this. So we're going to talk about that in a minute. Facelifts are typically performed using general anesthesia, where they knock you out, or local anesthesia with sedation may be used in certain less extensive procedures. After making the initial incisions, so we talked about where, depending on what facelift we're doing, where those incisions are, the skin is separated from the underlying connective tissue and muscle. So all this is open. This allows the cosmetic surgeon to reposition the deeper facial tissue. So we're talking about tissue, guys. We're not talking about muscles in here. That's a deep plane facelift. So the muscles that make you do this, these muscles, right? The muscles that make you do this, these muscles in here, these muscles here, these ones here. We're not talking about that. We're separating the skin from that. Reposition the deeper facial tissue. Get rid of the jowls to create a firmer foundation for the skin. Then excess skin is removed and the remaining skin is gently laid back over the newly rejuvenated facial tissue, giving the face a smoother and more youthful contour without over-tightening the skin. So I know we've all seen it, and we're going to talk about this, where people after facelifts like can't move their face, they lose movement, or when they smile, it looks like plasticky or really shiny. It's not like soft and supple like this. Part of that is still healing with swelling in your face and never getting that full softness. Part of that is sometimes it being too tight. So we'll talk about that in a minute. Can a facelift improve my eyelids too? Remember I said we'd talk about this. So it's not uncommon to hear the word facelift used when referring to any type of facial rejuvenation surgery. And understandably, a lot of people think that a facelift involves operating on the entire face, eyebrows, brows, cheeks, and chin, and eyes. That's understandable. After all, your eyes and forehead are part of your face too. However, a facelift on its own only addresses the lower 2/3 of the face, cheeks, and jawline. Why is that the case? It's largely due to differences in anatomy. The skin, muscles, and other tissue along the brow and the surrounding eyelids are very distinct, your orbital muscles, and cosmetic surgery for each of these areas requires an entirely different set of techniques than those during a facelift. So when we're talking about a facelift, like I said, we think the whole face, but think about like from cheekbones down. And there's 3 levels. There's mini, which is just this. There is standard, and then there is the whole thing, right? Or standard is the whole thing, but then there's deep, where we're addressing muscles as well as tissue and skin. It is common for patients to choose to have an eyelid lift, brow lift, neck contouring at the same time as a facelift. But in these cases, a cosmetic surgeon will actually be performing 2 different procedures in one single operation. Likewise, patients who only want to address aging around the eyes or neck typically can achieve that goal with only an eyelid lift or neck lift. We're going to talk about those in a different video, and not a facelift. So that's pretty much it. It just goes on to like other things that they do for the face, like rejuvenation, Forma, UL therapy, microneedling, derma fillers, Botox, fat injections, fat transfer to the face. And then, yes, it's permanent. So there is a whole section talking about the permanence of it, which we are going to go over. Life after a facelift. A facelift is a complex procedure requiring exceptional surgical skills, but the recovery process is surprisingly quick for most patients. This is a good segue. Patients typically return to normal daily activity about 2 weeks. Strenuous exercise will need to wait about 4, following a standard lift. And these time frames are normally even shorter after a mini lift. As every patient heals a little differently, your cosmetic surgeon will give you detailed instructions for aftercare and returning to activity. A lot of times they're not always detailed. So let's pause right there for a second. Guys, when they say you can return after 2 weeks, you can start doing exercise after 4 weeks, that does not mean you're going to be fully healed. That does not mean you're not going to still have swelling and tightness and firmness and like uncomfortable feelings. Doesn't mean your incisions are going to be fully healed yet either. They may be healed enough where they're scabbed, or the scab has just fallen off, but it's still gonna be a little rough. It's gonna feel tight. It's gonna feel uncomfortable. You're gonna feel the heaviness, the swelling. All that's still gonna be there 2 weeks, 4 weeks after. Now, caveat, that's not to say, if you're working with someone like me, and with facelifts, which they don't say, depending on how extensive the facelift, you may have drains, either in front or behind your ears. That is another thing. So with the recovery, like they said, if you had a mini, you may not have a lot of swelling. If you had something like a deep plane facelift, you're gonna have swelling. And if you are not doing manual lymphatic drainage or working with a plastic surgery recovery specialist like me, that's going to be a little bit of a struggle to get back because everyone's worried. It's your face, right? Bruising and everything's going to go away in 2 weeks. Hopefully, if it doesn't, come to see me right away. But bruising and swelling is going to come down a good amount, and you're going to be bandages off, out of the garment, all that stuff, right? But that doesn't mean you're healed. That doesn't mean you're done. They say you can, and patients typically return to daily activities about 2 weeks. Strenuous exercise needs to wait about 4 weeks. That doesn't mean you're not going to have swelling still. That doesn't mean you're not going to have scabs still. That doesn't mean after that time, all of a sudden you're just going to be healed and ready to go. And in a lot of cases, that's not true. In a lot of cases, unless you're seeing someone like me where you're actively taking responsibility of your healing after a facelift so that you don't heal with little fibrotic balls in there, which we're going to get to in a second, so that you don't have thick scars that are bulging off of your face and they're not red and purple and crazy. You need to be doing manual lymphatic drainage massages. If you don't know what that is, I have an entire course on it to teach you how to find somebody and what you need to be doing as far as your aftercare with your massages. That course is in our online shop. But if you are not taking care of your face during the recovery, it will not heal right. Yeah, it may heal tight, but I have a picture on my Instagram of 10 years post facelift where she was just like, oh, I guess this is just how my face is going to look now. One session with me and we can now see the contours of her face. You guys are paying for a procedure to lift the skin and get contours and bring your volume back and have your muscles look good. You want to make sure you're doing the recovery to get all that excess swelling and everything that's sitting on top of your results off of your body and back into your body, reabsorbed by your lymphatic system for you to pee it out, and you're doing proper aftercare to make sure that this does heal the way we need it to. Here's why I stress that so much. You know, I love whipping this thing out. My little map here. If we look at the face, do you see all of those green lines compared to the minimal green lines on the rest of the body? Look at how many green lines there are. Your head, neck, and face, we do specific protocols just for the head, neck, and face. Because the lymphatic system that gets rid of swelling in your head, neck, and face that's originally built in, that is working right now as you watch this video to keep the swelling out of your face, that system we're cutting into. And that system is so intricate, so tiny, and so vast that if we are not addressing that during your recovery, you are going to heal, like my client, 10 years later and still have swelling in your face that we can get rid of. So guys, if you're finding this video and you are multiple years after a facelift and you're like, oh, my gels never went away. Oh, but this still looks really like puffy. Oh, but maybe this is still really tight. It doesn't look as soft and natural as I thought it would. Schedule either a virtual with me or an in-person session in New Jersey, because you may not have done the cleanup properly of your face and of your swelling. Yes, you healed. Your body will heal no matter what. Your body will always heal. How it heals is a different story. So a couple things after a facelift, right, that can like go wrong or not heal right. So fibrosis. Fibrosis is an inflammatory process. It is the process of your swelling becoming thick and hard. If you are not wearing lipofoams after your facelift, if you are not wearing a proper compression garment after your facelift that is not cutting into your face but actually holding your face, it should feel like someone's hands holding your face. That's what your compression garment on your face should feel like. It shouldn't cut in where you have incisions. It shouldn't cut in under your chin. It shouldn't be really big here but super tight because you're yanking the top of that face garment and it's squishing the shit out of you. It shouldn't be like that. It should feel like someone's hands holding the skin and tissue on your face. That's it. That's how it should feel. So if you're having problems with your garment, right, and it is cutting into you, trapping that fluid and causing a buildup of fluid around your incisions will heal with, that's what they call like hypertrophic scars. Incisions and scars don't have to ever be bumpy. If your incision is healing with swelling inside of it, it's like a little pocket, and that pocket gets filled with swelling, and until you have someone like me that gets their fingers in there and knows how to reroute that swelling properly and is able to move the skin in certain directions and work with the rest of the facial lymphatic mapping to get that swelling to go back into the body, that scar will always be puffy. If you have puffy scars, schedule with me because we can get rid of that. That doesn't need to happen after a facelift. Your scars should be flat and they should be thin lines. Now, a lot of people say, oh, but my surgeon just made the scar really bad. I have a whole video where I talk about scars. Scars don't happen because of the cut. They happen because of the healing process of the wound before they become a scar. So if you're worried about scarring, taking care of your wounds and knowing the phases of wound healing, like I teach you in the course, is super important. But yes, that was my tangent there. Fibrosis, those little balls that we get built up under the skin, those are also little pieces of fluid that got really hard and stuck and started to congeal and thicken. We can also get rid of those still with manual lymphatic drainage, even 10 years out. Pockets that are heavy on your face, if your face feels really heavy, that is swelling that you have still inside there. If you are having problems, because we are talking about pulling the skin tighter, right? And then because your body swells because there's been an injury, it adds to that tightness and pulls the skin. If you still have tightness after your facelift, and not just like, oh, it feels firm and tight and good, but it's like tight and it's like, oh, this is like really, still really tight. My face still feels like it's pulling. That's swelling. We need to start doing some manual lymphatic drainage, check your garment, check your foams, and see what's going on with your healing. So yes, can you go back to my original point? Can you go back to normal daily activities? You can. Are you going to be fully healed and like no bruising, no swelling, your face is totally normal? No. But do you guys go back to your surgeon and they're like, oh, it'll go away. Oh, wait 6 months. Oh, wait a year. Oh, yeah, it looks great. It looks great. You're fine. And you're like, oh, I guess this is just how it's supposed to be. I guess it's just healed and this is how it is. No. If it doesn't feel right, it probably isn't right. So you guys kind of quit in like the last quarter of your healing and just kind of give up. And you're like, oh, I guess this is what it is. I'll just settle for it. It looks better than it did before. If I had a penny for every time I heard that, I would have like 1,000,000 pennies a day. But no, just because you are healed enough to go back to normal activity does not mean you're fully healed, does not mean you're done with your recovery. And that is the mistake everyone makes with a facelift, is they think, oh, my doctor told me I could take the garment off. Oh, my God, doctor told me I could go back to normal daily life. Oh, but my face still kind of hurts. But my face is still kind of numb. Oh, they said it might take a year. Okay, we wait a year and then we're just like, oh, okay, I'm over it. I guess this is what it is. So beware of that. Okay, next paragraph. One of the primary concerns patients have after following a facelift is how soon they will look presentable after their procedure, and understandably so. Unlike a breast or body procedure, for example, you cannot easily cover the area with clothing. Bruising and swelling are normal after a facelift and will be at their peak at about 2 days after surgery. After that, Bruising and swelling will gradually get better and should be difficult to notice at about 10 to 14 days. So again, that 2-week mark, right? That's why you can say that you can go back to like normal daily activity, because it will gradually get better. What happens when it stops getting better? What happens when it gets stuck? What happens when it plateaus? And you guys just keep waiting and waiting and waiting and waiting and waiting and waiting. And then 10 years later, you find me for a different thing. And I look at your face and I'm like, hey, you still got swelling in there. And you're like, oh shit, really? That makes sense. And then we get rid of it. So don't wait 10 years. Even so, many patients feel comfortable going out in public at about a week or so after their procedure. Your surgeon can advise you about when it is safe to wear camouflage makeup. That is something we're going to talk about too. As you ease back into your routine after a facelift, it is especially important to keep your face protected from the sun. You will be more vulnerable to sunburn for several weeks after surgery, plus staying out of the sun will help scars heal as inconspicuously as possible. Wear a wide-brimmed hat and apply sunscreen regularly, and sunglasses. That's something they don't say in here. Big, nice rimmed sunglasses help. Okay, so what do they mean camouflage makeup? There are certain, now we all know how, like, I don't wear makeup, so I can't even say this because I don't really know how it works, but foundation is supposed to cover things, right? People use foundation to like cover and then do all this like contouring stuff to their face. I honestly have no idea how it works. I don't have time for any of the makeup and things, so I don't know, but it's like movie set makeup. So when an actor goes on set and they have tattoos, but they're playing a role that doesn't have tattoos, they have makeup that camouflages really, really well. And it's like foundation, I'm told. Or it is foundation that goes on really smooth, but camouflages completely. So it's not just like foundation or cover up, it's actual camouflage makeup. And a lot of people use it for their facelift incisions. Here is my caveat to that. Your incision is not a full scar until a year. Yes, it may not have a scab. Yes, it may look like a scar, but that tissue is still healing. It is not fully integrated tissue yet. I would not advise putting anything on it until it is fully healed. We don't want to clog those pores. Sunscreen is different, but we don't want to clog those pores. We don't want anything suffocating the skin while it's trying to heal. None of that, right? So using those things too soon can be a problem. Same thing with scar tape and scar gel, especially when it's on your face. If you guys start using scar gel and scar tape too soon, you will notice your scar get red or purple. It means that it's not ready for that yet. If your scar is still red or purple, it means that it's having circulation issues and you are not using any kind of silicone scar treatment because it is not yet a scar. It is still a wound. So especially with facelift ones, when they're like in your hairline and you can't really see them much because they shave a little bit of hair and then they do the incision. So the hair grows back and then you can't really see the incision. You can feel it though. And then people want to do scar massage and all kinds of stuff, but you can't really tell where that wound is in the wound healing phases if it's even a scar yet. So being very careful not to do things too quick in your recovery is an extremely important thing. Now, quick little hack for a facelift: ice. Ice is going to be your best friend for a facelift. It's going to help with the swelling, the bruising, the redness, and all of that until it's calmed down and healed a little bit more and you're out of that first phase of wound healing, homeostasis, and inflammation has calmed down a little bit. Then you can come in to see us and we can start getting the swelling down a lot better, because once you are past that vasodilation, homeostasis, bleeding, scabbing, drains phase where it's like really raw, ice is not going to get rid of swelling that is trapped and healing in your tissue. Ice is only going to take down active inflammation. So ice is going to continue to work as long as it is red, hot, inflamed, all of that. After it is already past that 2-week mark, you need to start doing manual lymphatic drainage and getting those vessels to start pumping again and getting rid of that fluid and getting them to get the pressure off so they can start doing their natural job of draining your face 24/7. Otherwise, that fluid is just going to stay stuck and stagnant and heal inside of your face. So that is pretty much it for the article. Now, what I want to talk to you guys about as far as healing: garments for a facelift. There are lots of garments for a facelift. Some surgeons don't even give garments for a facelift. There are a lot of face garments. It is extremely individualized to each person as far as what you're getting done, where we need compression, and how much compression we need. If you are having a facelift and your surgeon gave you a garment but it's cutting into you, or you didn't give you a garment and you know that you think you might need a garment, or you have a garment and it's cutting into you and you're like, I got this on Amazon, I don't really know what I'm doing. Set up a virtual appointment with me. Call the office, 732-841-0142, and we will figure out your garment situation for your facelift. Also really important, knowing if you're going to have internal stitches or external stitches, knowing if you're going to have dissolvable stitches or stitches that need to be removed, knowing what you need to be doing for wound care. You need to ask your surgeon these specific questions. I know they don't give you a lot of instructions on this stuff, guys. If they do, follow them to the T. Once you're past your follow-up phase with your surgeon, where they're kind of like, yeah, you're good, just go ahead, heal on your own, you don't really need us, you're okay, then you can contact me and we'll see what we can add to your post-op care protocol that we can start integrating into your process and your healing. So your massages or foams and your garment or post-op cream or whatever we need to be doing to help get that swelling out of your face. Because again, like I said, the facelift is one of those things where you guys kind of just settle like a lot, because with lipo, it's a really big area and you're like, okay, yeah, I'm supposed to have curves. Cool, I got it. All right, yeah, I look good. This is good enough. I can, wear clothes. I'm happy with this. I will settle. With your face, you guys keep going to your follow-ups. You keep going to your surgeon. You keep doing all these things that they're telling you to do. And then at a year mark, you're like, okay, it looks good. I'm happy with it. But it doesn't feel like soft, supple, like youthful skin. It feels really tight. It feels really heavy. You have these creases in your nasal labia folds. You've got like these little balls in here. You've got like the scars that you can't see but feel are lumpy. Guys, we can still clean all of that up. Facelifts, when people say like, oh, I got a bad facelift, a lot of times it's not a bad facelift. A lot of times it's you didn't do any aftercare. You didn't do any recovery to help your face at all. The facelift itself is the procedure. Now, I want to talk to you guys about something too when we're talking about procedures. Blepharoplasty, eyelid stuff, right? So there's the under eyelid lift if you're having sagging skin under here. When you do that, they may do a little bit of filler or fat grafting to fill it out. Sometimes they won't even do the eyelid lift lower. They'll just do the fat grafting to fill this out because it's getting hollow. Upper eyelid lift. They will make an incision across the eyelid right in the crease of the eyelid and they will pull the skin. Now, there are some surgeons that I've seen that pull the skin too tight and the eyelid stays open like this even when your eyes are closed because the skin is too tight. That is like an extreme, guys, an extreme that I've seen. Usually with an eyelid lift, like you can see on my Instagram on that facelift photo that I have from 10 years ago, a lot of times the lower part of the upper eyelid will stay pink or red. The incision line will be red or pink, and then the upper part will also be a little bit like purple and weird. That's how you know you still have swelling in there. That's how you know that it's not fully healed, because it's not white. Guys, when your scars or your cuts are fully healed, they should be white. Like, let's see if you guys can see this on the camera. You see this incision here? It's not even an incision. My dog scratched me. It's a scratch. The white part is the actual cut. The darkness that surrounds it is because I'm using my hand all day and the scab got like busted open a couple times. The darkness around it is what's making the scar look super prominent. It should be a flat white line. It's flat. There's no bumpiness, no rigidness. I have scars. I'm allergic to bug bites. Yes, I'm allergic to saliva that is in the mosquitoes. I'm actually like, it will spread through my body. Oh my God, emergency room, like right now. I'm allergic to bug bites. It's a histamine response because I'm allergic to the saliva. Their saliva is basically acid in my body. Okay, I have scars all over my legs. I mean like all over. I have them like on my arms too. You can see these dark marks. Those dark marks are because the skin was so abused from being swollen and like acid in there for so long that it made a dark mark on the skin. Now, if you look at this, this is just from a bump. This isn't from a cut. This is a cut. This is just from the bump of the bug bite. It's not an actual cut. And that's what I mean by scars are abuse to the skin. So I have a bunch of those dark marks everywhere. Those are from the bug bites. I don't know if I have any on my forearms. Because I'm brown and melanin is a wonderful thing, those dark marks usually go away. But I have tons of them all over my legs. It's insane. I look like somebody took a Sharpie to my legs and just dotted away at me. because the skin and the tissue abuse to the skin, with all of that stuff in there causing that reaction, is what's making it dark. It's not like this where you can see a white thin line and then the darkness around it. It's the dark mark itself because of the abuse to the skin. So when we're talking about incisions and we're talking about trying to make them look as like inconspicuous as possible, you want to make sure that skin around the incision doesn't stay swollen. You want to make sure your garment's not cutting into that. You want to make sure that you're addressing that, which is why, going back to the eyelid thing, that incision line itself should be a thin white line. There should be no coloring on your eye. There should be no purple, no dark, no anything on your actual eyelid. It should just be the incision itself, the white line. If it's not, you probably still have swelling. That whole thing's swollen. Now, here's another way to tell. I'm going to get real close, guys, real close and personal. Hold on. Okay, so see how you can see this lining of my eyelid? If you've had any eye surgery done, the lining of your eyelid, I have to get up and close for you guys to see what I'm talking about. This part, this little pink part. When I'm looking at you normally, you'd be able to see that hanging or really, really thick, or it might look like somebody took white eyeliner and traced the eye. More so with the upper eyelid, you'll see where the eyelashes connect to your eye, this whole thing, you'll be able to actually see it as if somebody flipped my eyelid open like this. And you'll see it just looking straight at the person. It'll be swelling all around that whole thing and in here. It'll look like somebody's taking their finger and pulling the eyelid down like this. You'll be able to see that inner part because it's so swollen and inflamed that it's sticking off. So if you guys have had eyelid procedures and things like that and that's still happening, you still have swelling. You never fully recovered. So the hardness, the rigidness, all of that. Now, eyebrow lift and forehead lift. The incisions will be in the hairline up here, and this will be pulled up like this, right? So you won't be able to see it as much. But another really good indicator if you've had a facelift, and this is how I knew with my angel client lady that I have on my Instagram, this is how I knew she still had swelling. When I looked at her, I could see every single pore in her forehead, way major opened. That is not just having open pores, because I can see the entirety of the tissue and all the super deep pores being held open because the swelling is pushing on that skin and that skin is so tight. So if you've had facial procedures done and on your chin, because on her chin, you can still see it in the photo, what I'm talking about right now, you can see those really deep pores, because all of this was still so incredibly swollen. So even if you didn't have a face procedure, guys, since we're talking about this, if you do notice that your pores are that open all the time and big, and you can see them like crevices in your face, like little tiny baby craters all over, your face is swollen. You need to do something about that. And it could be for a number of reasons, but your face is swollen. And I'm sure you can feel it too. So that's another indicator that we have a problem and we never fully recovered. Now, all of this can be taken care of. Garment, foams, manual lymphatic drainage. If you have had manual lymphatic drainage, quote unquote, or lymph massage or lymph drainage, and it, quote unquote, didn't work because you still have swelling, you may not have gotten the right thing. Because when we're addressing the head, neck, and face, we are addressing these lymph nodes first, these lymph nodes here, and then all we're doing, I'm getting real close to you guys today. Oh my goodness, I am so sorry. I'm all up in your face. But addressing that lymphatic mapping, everything from here drains outwards into your pre and post auricular lymph nodes and your jugular lymph nodes. Oh, good. You guys can see my breakouts. So my hair, my face is allergic to my hair. My hair's washed. My hair's clean. My face is allergic to the proteins in my hair. So when it touches my face, literally within 20-30 minutes, I get these bumps of swelling. Now, these aren't pimples, and this is something else I want to talk to you about, because after facelifts, I know I'm sidetracking. I will come back, I promise. But after a facelift, you guys get these little pimples, like these little hard, swollen nodule things all over. This is swelling. I've had 2 lymph nodes removed when I was a child. My face will always be hypersensitive to not just my hair, but if I'm wearing a fur scarf and the fur touches me, I will get these swollen bumps. And again, these swollen bumps are dark. That's all they are. They're not actual pimples. They're swelling. They're big pockets of swelling because I'm missing parts and my face doesn't drain normally. So I have to, do things to help with it. But when you're working on your face, anybody who's doing manual lymphatic drainage on you, it's not about going up, going down, don't go up, don't go left, don't go right. It's not about that. It's knowing the lymphatic mapping and how it works. So when we're doing lymphatic drainage on the face, we're placing the hand on the face, stretching the skin, and releasing. That's all we're doing. That's it. If somebody's trying to rub your face with oil after a facelift, run. If someone is trying to rake through your face, I see all these like a gua sha is one thing, but I see all these lymphatic facials where they're digging at the person's face and the head's going back into the table. That is not lymphatic drainage. Remember, the vessels are a hair thick and a hair deep underneath your skin. That's it. And they're everywhere. So knowing what sections to work in which way and how we're going with that, and where we're opening those drains and how we're moving that fluid is very important, especially for a facelift, because pre-auricular lymph nodes right in here in this pocket, post-auricular lymph nodes behind your ear, and then jugular, and then subclavian veins. You're getting a facelift or some sort of face procedure done right where everything is supposed to filter out. You're getting cut. You are cutting right across that drainage channel. Then you have a garment cutting right into that drainage channel. So having somebody that understands how the lymphatic mapping works to reroute around to get these lymph nodes to still work, but to reroute with the lymphatic mapping to get it to its exit, which is here, is extremely important. If you don't have a therapist that did that or explained it to you, you may not have gotten the right type of massage. If you don't know how to find a therapist or want to learn more about that lymphatic mapping and how it works, our course. I talk about it in our course, and I teach you guys that in our course, more in depth, so that you know what you're talking about, so that you can go find somebody to help you. If not me in New Jersey, someone else. But when we're talking about face MLD, it's just this. That's it. That's literally all it is. It's nothing. I want you guys to put your hands with me right now. Just drop your fingers on your face. Not your fingers, but your wrists. Slide your wrists up. Move all the skin on your face. And then slide your wrists back. That's lymphatic drainage. And let go. That's it. That's all it is. Now, obviously, we're doing different techniques in different areas, rerouting a different way, going all over the place, doing a whole little routine of things. And like they said in that article, this section is different from this section, is different from this section with how it drains. So it's not just go one direction and do this the whole session. And it's not just do this, or do this, or do this, or some of this crazy shit I see online. It's not that. It's extremely technical. So having somebody that understands that is super duper duper important. But beyond that, your garments and your foams, and making sure that you are not doing anything to retain that swelling, which will be your garment, which will be some of it as diet. And it's not so much like you need to eat more of some things, it's you need to eat less of some things that are causing your body to build that swelling up. And that's you need a session with me for that, because that's a lot. But the biggest problem with facelifts is the recovery, because it is your face and you guys freak out about that. But then you also kind of just settle and think, oh, it's better than it was before. Or you get a facelift and then be like, oh, it didn't work because now I can see all these lines in my face. Or they pulled my skin too tight, which I hear all the time. And I'm like, no, honey, you're still swollen. They didn't pull your skin too tight. You're just swollen. That swelling is in this tiny space and it's blowing it up so much that you can't move your face. So major things for this video. There are different types of facelifts. Face does not include eyes or forehead. Incisions don't have to be raised and bumpy. They don't have to heal that way. And if they are, that is a red flag. It is a red flag if you're feeling still 6 months to a year out that your face is so stiff and tight, or you're feeling little granules, or you're feeling heaviness still, that can still very possibly be swelling. You guys, a lot of times in your neck, will see that swelling and feel that swelling but it's not as bad as before. So you're like, oh, it's okay. Or when they pull the skin tight and you start to see all these muscles, you start flipping out because you're like, oh my God, what did they do to me? I look worse than before. This anatomy is supposed to be here. All of this, all these muscles, this is all supposed to be there. You're supposed to be able to see all of that all the time. So that is something you need to talk to your surgeon about before the facelift, is if you want those muscles to be pronounced or if not. A lot of times what they'll do is after the facelift, if you don't like it, seeing all of that, they'll do a little bit of fat transfer in the neck to give it a little more fullness so that you're not seeing those muscles as much. But that's a different story. That's person to person, surgeon to surgeon. Let me back up so you're not like in my face, guys. I am so sorry. But yeah, different types of facelifts depend on what you need. Facelift does not include eyebrows. Everything here up, facelift does not include. It's 2/3 of the face down. Mini facelift is just pulling a little bit of the lower face skin. SMAS facelift, standard facelift, is just addressing skin where they can cut off extra skin if they need to, and it can go from here to the neck. Deep plane facelift is where they're addressing the muscles, the platysmal bands. They're moving fat pads to fill you out a little bit more. They can do a lot more structural, not as much, not so much just the skin, but also the deep structures of the face if it's a lot and we need a little bit more, rather than just the skin itself. Recovery, yes. You will stop inflating at 2 weeks if you are not having too much salt, drinking enough water, and have a proper garment. You will stop inflating and bruising, and it will start to come down. You can resume normal activity. That does not mean you will be healed. If you are not doing manual lymphatic drainage massages, if you are not taking care of your face, if your garment is cutting into you or it's too loose or you don't have a garment, if you're not doing any of those things, it will take way longer to get rid of the swelling and the bruising. If your swelling and bruising is still pretty excessive at like 3 months, you should be getting manual lymphatic drainage. Do not wait for that swelling to harden and turn into fibrosis and become those little balls and your incisions to heal with that swelling in there. Don't wait. Start soon. If you go back to your surgeon, they keep telling you to wait, you do wait, and then at the 6-month mark, you're like, okay, I'm going to take care of this now. That's totally fine. It's not too late. I have that picture on my Instagram, 10 years, we're still able to get that swelling off of her face. The only thing you need to worry about with your facelift is the cleanup, is getting rid of every last bit of swelling, is making sure that every incision heals flat. It's all about the healing afterwards. So that's pretty much it. If you guys need help with garments and supplies and swelling and learning what to do for your face afterwards and about your massages to make sure your swelling comes down, all of that stuff, you can set up a virtual with me. Call my office, 732-841-0142. Or if you're in New Jersey, come in to see me. You can come in pre-op so we can get you set up with all of this, or you can come in post-op afterwards so we can get all of it down. Pre-op is always better, so I can set you up on a care protocol, explain to you what you're going to do, and we start before we even have surgery. Post-op, we can still clean everything up. It's not going to take longer. It just may be a lot more instructions for you to handle when you're already like, and your face is like, and swollen and uncomfortable and all of that. So that's same office number, 732-841-0142. If you have no idea about your massages or what's supposed to be happening or this whole lymphatic thing and you know you need it and you're like, okay, help me understand the basics. Help me understand how my swelling is going to happen, how my body is going to be healing itself, what I need to be doing and what I need to be not doing during my healing to make sure I don't get fibrosis, complications, hardness, things like that, and how to find a therapist to help me and what that therapist is supposed to know, what's supposed to happen during these lymphatic sessions, all of that. The course is on our post-op shop. So amarepostopshop.com. The link is in the bio on our Instagram. It is also on our YouTube in the description box. So you guys can find it. And if you need your foams and supplies and soap for your face after the facelift to make sure that your incisions are healing well, wound care to make sure that the skin around the incisions are protected, the foams to put in your garment to line your garment so that it's not crushing you or cutting into you. All of that stuff is also at amarepostopshop.com. So guys, that's pretty much it. Quick little rundown on the facelift situation. I will be doing like deeper videos on the facelift situations as far as like mini, eyes, forehead, all of those things separately. So I can go a little bit more into detail about the healing and the procedure. And keep an eye out for those. And I will see you guys soon. Ashley with the Mare. I hope this was helpful. Bye.